Welcome to the world of cholinergic receptors, where messages fly faster than Wi-Fi, and one molecule, acetylcholine, keeps the entire nervous system in sync. Meet the two squads. The nicotinics, fast-acting and in charge of your muscles, and then there's the muscarinics, smooth, chill and masters of organ control. Together they make sure your body breathes, beats and blinks without you even thinking about it. So grab your notes, because once you learn how these receptors work, pharmacology suddenly starts making sense. Cholinergic receptors are special protein molecules found on the surface of certain cells that bind to acetylcholine, the neurotransmitter responsible for transmitting signals in both the central and peripheral nervous system. There are two types of cholinergic receptors, muscarinic receptors and nicotinic receptors. Muscarinic receptors. There are 5 subtypes: M1, M2, M3, M4 and M5. Generally, they are located on the effector organs of the peripheral nervous system, like the smooth muscles, cardiac muscle, and glands. They belong to a class of receptors called G-protein coupled or metabotropic receptors. Specifically, they are either GI or GQ receptors. GI receptors are inhibitory because they decrease the formation of cyclic AMP. GQ receptors cleave PIP2 into inositol 3-phosphate and diacylglycerol. IP3 then causes the release of stored calcium from the sarcoplasmic reticulum, which then causes contraction. M1 receptors. They are located in the brain, particularly the cortex and the hippocampus, the autonomic ganglia and gastric glands. They are GQ coupled receptors. They cause increase in cognitive activity as well as cause gastric acid secretion. Think. M1 sharpens the mind and digests your meal. M2 receptors. They are located in specific parts of the heart like the SA node, AV node and atrial tissue. They are GI coupled receptors. They decrease heart rate and contractility. Think. M2 receptors slows the heart rate too. M3 receptors. They are located in smooth muscles like those of the bronchi, GIT and bladder detrusor. Also glands like the salivary, lacrimal and sweat gland. Sphincter pupillae and ciliary muscle of the eye. As well as the endothelium. They are GQ coupled receptors. They cause increase in secretion of saliva, sweat, tears, and bronchial mucus. Increase in smooth muscle contraction leading to bronchoconstriction, bladder contraction and increased gut motility. Meiosis in the eye, that is pupil constriction and accommodation, and finally nitric oxide mediated vasodilation in the endothelium. Think. M3 makes you moist and moves muscles. M4 receptors. They are located in specific parts of the brain like the striatum and cortex. They are GI coupled. They decrease acetylcholine and dopamine release in the brain and also maintain the balance between dopamine and acetylcholine in the brain, aiding in movement control. M5 receptors. They are located in parts of the midbrain, namely the substantia nigra and the ventral tegmental area. They are GQ coupled. They increase dopamine release, causing reward and motivation. Think. M4 and M5 fine-tune the mind. Nicotinic receptors. Nicotinic receptors are cholinergic receptors that respond to acetylcholine and to nicotine. They are ligand-gated ion channels, aka ionotropic channels, because they cause depolarization and excitation. Nicotinic receptors have 2 subtypes, N sub N and N sub M. N sub N, or nerve nicotinic receptors, if you will, are located in both the sympathetic and parasympathetic autonomic ganglia, and also in the adrenal medulla. They play a role in transmission of impulses from the preganglionic to postganglionic neuron. They stimulate the adrenal medulla to release epinephrine and norepinephrine. N sub M, or muscle nicotinic. These guys are found in the neuromuscular junction of skeletal muscles. They open sodium and potassium ion channels, leading to depolarization and muscle contraction. So guys, in summary, M1 receptors are located in the CNS and gastric glands and are GQ coupled. M2 receptors are located in the heart and are GI coupled. M3 receptors are located in smooth muscles, glands and in the eye and are GQ coupled. M4 receptors are located in the CNS and are GI coupled. M5 receptors are also located in the CNS and are G-Q coupled. For nicotinic receptors, N-sub-N receptors are located in the autonomic ganglia and adrenal medulla. N-sub-M receptors are located in the neuromuscular junction. Memory hacks. For muscarinic receptors, remember M1 in the mind, M2 in the myocardium, M3 makes things move and moist. GQ for odd and GI for even. Odd numbers 1, 3 and 5 and even numbers 2 and 4. For nicotinic receptors, remember neural for N-sub-N receptors and muscle for N-sub-M receptors. Until next time, stay safe, stay happy. This is Mnemonic-based medicine.